Hi, my name is Breanna Santoso. I'm a second-year medical student at OUHCOM in Dublin, and I will be presenting Insertional Achilles Tendinopathy with Gastrocnemius Recession. Achilles tendinopathy is a common problem that presents in foot and ankle practice and can be separated into two groups, insertional and non-insertional. Our study focuses on insertional Achilles tendinopathies, which are less common, making up only about 1/5 of Achilles tendon injuries. Both insertional and non-insertional Achilles tendinopathies are first treated with conservative therapy such as stretching, orthotics, and forms of soft tissue treatment. When conservative treatments fail, surgery may be indicated. Surgical options for both groups differ and can be significantly invasive. Insertional Achilles tendinopathies are more commonly treated with surgery, as these patients typically fail conservative treatment more often than patients with non-insertional. A visual analog scale pain scoring, or VAS score, is a validated, subjective measure for acute and chronic pain. Our study uses VAS scores to determine the level of improvement after surgery and compare the outcomes between different procedures. A calcaneal osteotomy is typically indicated as a surgical approach to treating insertional Achilles tendinopathy. So it's basically an invasive procedure in which an orthopedic surgeon controllably breaks the heel bone to correct deformity of the foot and ankle. Calcaneal osteotomies show overall good outcomes in improving pain. However, patients often experience a long recovery time to meet optimal results. On the other hand, a gastrocnemius recession lengthens the gastrocnemius muscle in the posterior compartment of the leg. This allows the heel bone to shift downward into a more natural position. Fortunately, the healing process is relatively short, and recovery typically takes about 6 to 8 weeks after surgery. While there is literature supporting the use of gastrocnemius recessions in treating the non-insertional tendinopathies, our study aims to define a less invasive approach to improving symptoms in patients with insertional Achilles tendinopathies. In using preoperative and postoperative visual analog scale pain scoring, we hope to define gastrocnemius recessions as a viable and less invasive procedure for insertional Achilles tendinopathies. We performed a retrospective chart review from patients who received an isolated gastrocnemius recession within the last year. 22 patients were eligible for inclusion, and we compared VAS scores on a scale from 1 to 10 to measure pain improvement after surgical correction, 1 being less pain and 10 being lots of pain. Preoperatively, 22 patients reported VAS scores that averaged to 5.2. And then our results show that at 2 weeks post-surgery, 18 patients reported an average of 2.44, 16 weeks, 2 patients reported an average of 3.5, 8 weeks, 6 patients reported an average of 4, 10 weeks, 6 patients also reported an average of 4, 12 weeks, 4 patients reported an average of 2.5, and at 16 weeks post-surgery, 3 patients reported an average of 2. We indirectly compared our VAS score results to a study done by Choi and Suh, where insertional Achilles tendinopathy was corrected using a calcaneal osteotomy. In this study, VAS scores averaged to 8.9 pre-op, and then by 3 months or 12 weeks post-op, it decreased to 7.5. In contrast, VAS scores for our study averaged to 5.2 before surgery, and then decreased to 2.5 by 12 weeks. So this was a 2.7 decrease in our study compared to a 1.4 point decrease in the comparative study. Even though the time frames differ between the two studies as well as the preoperative VAS average scores, in the calcaneal osteotomy we do see pain resolution, but it appears to be over a longer time period. Our study does have some limitations. 8 or 34.7% of patients were lost to follow-up after surgery. And the patients included so far in the study were patients seen after August 1st, 2021, so data on follow-up is not as extensive. So in conclusion, gastrocnemius recession appears to improve patient care when treating insertional Achilles tendinopathy due to faster recovery times, lower patient costs, shorter surgery times, and its minimally invasive nature. We plan to expand our patient population to increase the amount of data available for analysis in future projects. Thank you for listening.